the Built Environment for Health Professionals training series. Today we will be hearing a presentation by Sara Forsting, and the presentation is titled Understanding a Community's Needs. All right, I'll pass the mic off to you, Sara.
Thank you. Hello, and thank you for watching my presentation regarding our work around the built environment and the kind of data we collect at Vancouver Coastal Health to help us better understand what our communities need. I'm an epidemiologist with the Public Health Surveillance Unit at Vancouver Coastal Health, and today I'm going to share with you a little bit about our community-wide survey that we conducted to help us collect local-level data that we could use to better plan our policies, our programs, and the work that we do with our neighborhoods. So back in 2013, 2014, the Vancouver Coastal Health and Fraser Health in British Columbia conducted a community-wide survey called My Health, My Community. And this survey had a number of questions, quite a few questions actually, and this are the 6 categories we used to collect the type of information we felt we needed to get at for our communities. And this was the first time for British Columbia, at least, that they've done a community health survey at this level. The 6 categories we used were socio-demographic questions, so things like your gender, your income, where you live, that type of information. Your health status, so information specifically about your health. Lifestyle, do you drive, do you walk, what kind of food do you eat? Your access to health care, do you have a primary care physician? Specific built environment questions, and that's why we're bringing this here today to share. And those kind of questions are about distance they live to bus stops, how they commute to work. And then finally, community resiliency, so how comfortable they felt in the neighborhood. Did they feel connected? How long did they live there? So trying to get at some the type of information we haven't had access to before for our neighborhoods. So the way we collected this data from our citizens was primarily via an online survey. We did also have some paper versions available for folks that prefer to do it that way. We collected surveys from citizens 18 years or older, so we don't have any, unfortunately, don't have any youth survey data available. We promoted the survey via media and social media, and also through our community partnerships. So different nonprofits that we work with, primary care physicians, healthcare providers. We did outreach ourselves and went to all kinds of community events and locations to actively recruit folks to take it. And we also provided incentives, so lots of freebies, contests to promote people taking this survey. And then we also did some targeted outreach, and that was really to make sure that we were getting a representative sample. So in order to get something that we could say actually represented our communities, we were looking for a 2% population target, which for Fraser Health and Vancouver Coastal Health meant we needed 43,000 surveys to be completed. So we did some purposeful sampling, so getting out there and actually targeting groups of people we knew we needed to collect more data from, whether it be men, young people, so 21 and younger, or homeless. So we made sure to keep track of our categories so we could actually target specific groups we needed to get more data from. And then we did specific outreach, so targeting those groups, targeting those communities to go out and promote this survey and help them understand the importance of collecting this information from them. And then after having the data, we did do some post-collection weighting to make sure it is representative. So we did weight our data results by age, gender, education, and geography, so the municipality they lived, to make sure it was representative. So in terms of the results, what did we actually get? We had 33,000 surveys completed in that year that we did this work. So about 77% towards our overall target. Within the separate health authorities, VCH got very close, so 99% of our to our target, and Fraser Health a little bit less at 62%. You can see by this map, the darker green is the areas we got better, got closer to our target, and the lighter green is a little harder. So more of the rural areas can be a little more challenging to get that data from, though we did have people on the ground recruiting folks to take these surveys. So one of the outputs from the survey, we've been working with this data since it was collected in 2014. One of the first things we put out was we really wanted to get this data back to the community level since it was so unique for us to have this kind of data available. So we created things called the community health profile. So each community in these 2 health authorities, we developed one of these multi-page handouts or PDFs, and this actually kind of walks through overall highlights from the surveys that we found. These are standardized reports for our communities, and folks can pick this up and get pretty up-to-date data regarding kind of the same 6 categories we went over at the beginning for the survey. This is the example for Vancouver, and each community health profile includes what we call a spine chart. This is a 1-page document, that table that walks you through those various categories, the demographics, some of the health status, primary care, built environment, and then it compares your community to the overall metro community and then to your health authority, and then where you fall, this is the spine we call it, where you fall compared to others. So a way to kind of see where my community, how it's shaping up compared to the other neighborhoods in the Vancouver metro area. And these have been useful. We've gotten feedback that these have been very useful for the communities to help them better understand what's going on and where to put some of their efforts. So not only do we have information about the physical aspects of these folks' communities, geography, built environment, we also know and have available their health status outcome, kind of self-reported health status. So this map shows you how people have rated their physical health as excellent or very good. The darker purple people are above the average Metro Vancouver level, and the lighter purple below the Metro Van. So it does give health authorities and nonprofits an opportunity to say, hey, you know, maybe these lower, what's going on in these lower purple areas, lighter purple, with the lower health status. So how do we tease out what's going on there? And similarly, we also ask people about their mental health status. And you can see some of the light purple tend to be very similar to the physical health. But you know, if we're thinking about built environment, we can maybe target these areas and use the built environment data to say what's different about these communities than the rest is one aspect we might be able to control. So it's along the same health status outcome, we have information about obesity, and that gets talked a lot with the built environment and active living piece. So we have that kind of data down to our neighborhood level for our communities. And the other thing we did do is we can go ahead and compare communities, and this has actually been really helpful and a great conversation starter for these communities when they can see where they fall compared to everyone else. So for Vancouver in obesity, you see the red arrow in the lower left-hand corner. Vancouver ranks very well compared to the other Metro Van and Health Authority communities, and we get up to like Powell River, Chilliwack, not quite doing as well, and quite a bit above the Canadian value too. So this just gives them some context of where they're at. And we have never been able to do this before for our communities. So when we zoom into the built environment indicators and the community health indicators that we collected, this was in that spine chart table for Vancouver, you can see the kind of questions we asked people. We asked them, did they commute via car, public transit, or walk? And we can break that down. How long is your commute time? How long are people spending out from home, getting to and from work? What are your primary mode to run errands? Trying to get at their active. Are they able to actively transport themselves around by walking or cycling? We also looked at secondhand smoke exposure in public places, sidewalks well maintained, amenities within walking, cycling distance, and transit stops. So questions we know that have been asked in other communities that we can then compare out, and things that we actually knew that some of our partners and cities actually wanted to ask so they could find out about their citizens, this type of data. So for walk, cycle, or public transit as a primary mode of commuting to work or school, we look at Vancouver again, upper left-hand corner, red arrow, they are the top. 60% of survey respondents were using it as their primary mode of commuting to work or school during that year, compared to some of our more rural communities way down at the bottom. So Powell River, Seashell were much less likely to be walking or cycling or using public transit to get to commute. So this gives you an idea maybe in your neighborhood, in your community, if you live in Vancouver, Coastal Health, or Fraser Health, what communities to target if you're looking at increasing more of an active transit to and from work or school. We were also able, because we collected people's home postal codes, we were able to map all this data and give people a more visual look at how this data breaks down over the kind of geographic span of our communities. So the same question, the walking, cycling, and public transit commuters, and we mapped that with the darker purple again being the higher than average. And then what we laid down was a layer looking at the existing rapid transit and bus lines and C-bus, and then at the time what they were proposing to add and some new transit areas. And you can see the blue lines being the existing, those often have the darker purple, higher average people doing active transit, and there are lighter purples that have almost no access to these kind of transit service and routes, which makes sense. It does make sense, but hopefully it could be used by communities to help maybe guide discussions about where this kind of transit could be added to support services. We looked at exposure to secondhand smoke every day or almost every day in public places, and our survey respondents got back to us. Here you see Vancouver. Actually, they have 30% of them were exposed to secondhand smoke every day. I think that was a bit of a surprise for us, but an interesting thing to dig into. And who are these people? Learning a bit more about who they are specifically age-wise. Are they students? Are they adults? Are they commuting to and fro? Where are they being exposed to secondhand smoke? And then we saw for our rural areas, much less likely to be exposed. So again, a way for us to target our work and our efforts. For exposure to secondhand smoke, one of the interesting cuts we did was looking at income groups. And what was quite clear to us in Metro Vancouver, in the Fraser Valley, rural and urban, was that the less money you make, the more likely you are to be exposed to secondhand smoke in public places. Then that trend seemed to hold steady, with the exception of coastal rural. Theirs was just the under 40 grand, and then anyone above that, less likely. But that's something, an interesting see to where an income disparity where folks making less money obviously have exposed to more risky health behaviors. So another thing we wanted to look at was the sense of place, so the strong sense of community belonging. This is an example of Vancouver. Over half of them saying they felt like they had a strong sense of community belonging. When you divide that up by age, you see that definitely increases as you get older. And also the gender-female split, fairly even, but females feeling a stronger sense than males. But this data really allowed us to dig into this piece. And then we could even look at community-based. How are the community, who feels more stronger sense of community depending on where they live? And this was an interesting one, the breakdown. Actually, the rural community is much more likely to have a stronger sense, and then more the urban areas less likely, so a little more disconnected down there. With Vancouver down close to the fourth from the bottom for feeling connected. So one of the very specific things we use for My Health, My Community, the opportunity came about within a year, I believe, of the survey's closure to report out on the transportation findings we had in our survey. So to give some locally relevant data about transportation and its connection to health and what we were seeing in our neighborhoods, and have data that was really relevant to our mayors and our policy planners. And also at the time there was the transit referendum. So this gave people the kind of the health side and being able to use that data to show here's the current status and what does it mean with this transit referendum and what the vision could be for the future. So we put out both a specific profile around transportation and health, and that is available on our website, and then also some talking points for medical health officers to speak to in the media, and then just some general information graphics talking about obesity and commuting and time in your car and how much time you're spending in your community, that community connectiveness. So this is an excellent opportunity and timing for us to use that data for something pretty relevant. So these are some of the graphics that we put out around commuting to school and active transportation. We hired a graphic designer to help us come up with these to make them more interesting. Sometimes showing data can be pretty dry, and so for us we really wanted to be impactful and have be something that could be picked up in social media easily and spread around, or on the visual media. So for that transit referendum work, we really had 6 key messages, and that was part of what we put out to help drive the discussion from the health end. So it was a bit of us making sure we had very finite points that our health officers could speak to, and that were easy for people to digest and kind of take-home messages. These spoke to active transportation, to physical activity, to community belonging. So really showing the benefits of transit and active transportation in their communities. In terms of what's upcoming for My Health, My Community, we currently have what's called the My Health, My Community Atlas, and this is online. It is now available. If you go to the myhealthmycommunity.org website, you can link to the atlas. And this gets down to the community level indicators, and you can actually play around and select what community you want to look at, what indicators you want to look at. It will map them for you. It will allow you to compare them to other neighborhoods. Here's a screenshot from that atlas. And you get actually access to more indicators than you would just from our profiles that we put out. So this is a more of an interactive online way for our planners, our environmental health professionals, our nonprofits to get the data they need without having to come to our surveillance unit and put in a data request. So this allows people access to touch the data. They're a pretty easy to use interface. And actually, I think there's ways to actually extract the data if they'd like to manipulate the data a bit more than what's available here on the Atlas. So that is currently available online. The next thing coming out is we went down to a finer geographic level. So within those communities, we went down to the neighborhood level. I think, for example, Vancouver has 14 neighborhoods or something around there. So we have over 100 neighborhood spine charts. And these are these one pages with all those indicators and the little graphs showing how people compare. And these are going to be available online, My Health, My Community, in the next 2 weeks. So folks can get down to an even finer level and start looking at some of those things and making some comparisons. The final piece, which is relevant here, we do have a number of other reports we're working on for My Health, My Community data, but one that, at least for this purposes, is the Healthy Built Environment report. So this is digging in a little bit more into the built environment indicators we had and the health indicators and sense of belonging, and doing a very specific report about the findings for both Fraser Health and Vancouver Coastal Health jointly, and putting that out. So that work is scheduled to start this summer, with hopefully something out initially in the fall. You can keep an eye on myhealthmycommunity.org to see when that comes out. Yeah, so there's the website for finding access to all the surveys we've completed, to the outputs we're putting out and presentations we've given. And if you'd like to contact me or my staff to ask us specific questions, you can find our contact information on that website. Thank you.